Okay. So if we're looking at the anatomy of the hip, certain things that we need to find. One of the first things to find is the ASIS here at the front, and if we follow the iliac crest backwards to the PSIS here, and these are going to be two of our landmarks, they're in line with each other. These are going to be two of our landmarks to find a lot of the hip musculature. And if we come down here to the greater trochanter as well, this is going to be our third point. We can use the ischial tuberosity as well, but to start with, it's much more important to find these points. So if we look at what's going on in the lateral aspect of the hip, if we start from the anterior, we've got TFL. So TFL is going to attach from the ASIS, and it's going to run back to the trochanter. But what we're going to have here is the anterior aspect of this here, this bulk, is more muscle, and then there's a more fibrous connective tissue band running back here. So running from the ASIS back to trochanter, this is going to be more connective tissue, the muscle bulk here. And if you draw a line between the two, halfway along that line is sort of a demarcation between this muscular tissue here and this connective tissue. So this is going to form this line here. If we follow the line back to here to find the PSIS, here, there we go, PSIS there, that's where it is. And we draw a line just from anterior to here. So if we follow this back off the PSIS onto the iliac crest and draw a line from here to the trochanter, this is going to be the anterior aspect of glute max. Then glute max is going to continue down to the sacrum, continue down here below the tuberosity and back over to the femur. So all that is glute max. And so what we have here is TFL, glute max, and you have this kind of like V shape where glute med is more superficial. But glute med isn't just here, because glute med runs from the ASIS over here, right the way to trochanter, and it's running back to the PSIS here. So actually glute med is about that big. So that's quite a significant muscle there. Now if we're looking for glute min, that's actually deep to glute med. So from here what we need to do, find the ASIS, PSIS, again those are our landmarks. If we draw a line here, roughly at this level on the iliac, or on the innominate bone here, on the lateral aspect here, we've got this kind of like crescent shape that runs across here where glute min attaches, a little bit more anterior, and then tracking back about 2/3 to here, glute min is underneath there as well. But it's very deep, so difficult to get to by hand. You'll notice different sizes and shapes of the innominate bone here, and one of the things you want to do before you do any needling on the lateral aspect of the hip is trace the ASIS to the PSIS and feel for the iliac crest here. So you can actually see this is quite a significant mass of bone here. Now as we move back, we mentioned we've got glute max here as well. These are our superficial muscles. These are TFL, glute med, glute min, all abduct the thigh and internally rotate because of their location. As we move to glute max, we've got extension, lateral rotation, and then we can find piriformis. So rather than just guessing and pressing at the most tender spot for piriformis, if we track back, find the PSIS here. If we drop inferior medial to PSIS, track it back here, okay, and we drop into this indent here, this is going to be S2. So there's S2, it's the most prominent indent. If we track down here to the natal cleft, just above the natal cleft here, you've got the sacrohiatus. If we move lateral to that, we'll be able to find sacroforamen of S4. We should have S3 in the middle there, S4 here. If you're not sure whether it's S4, track underneath that till you find the bottom of the sacrum. So this must be S4 here. Piriformis lies on the anterior aspect of the lateral border of S2 to S4 and tracks to the greater trochanter. So if we follow from these positions to the lateral border of the sacrum, which is here, come across, piriformis has got to fall over here in between these. So it's going to be in here somewhere. Another way to identify it, if you want to needle it, is find S2, S3, S4. If you move laterally from S4 until you drop off the sacrum, that's going to be the medial trigger point there, bladder 54. Alternatively, find S2, find S3, draw a diagonal line from S3 to the trochanter, and it will fall along that line. So piriformis will track that line because it's actually running below that over to here. So if you come across from 4, you'll hit the line as it tracks diagonally. You follow that. So that's going to be piriformis there. Now what about the other deep rotators? So as we move over, we've got ischial tuberosity over here. If we move up from this, we can feel that bony mass. We've got the deep rotators. So we've got gemellus superior, we've got obturator internus, we've got obturator externus underneath that, we've got gemellus inferior, and we've got quadratus femoris in there. Now they all kind of clump together a little bit as their attachments around the lateral aspects, or the lateral aspects of the hip towards the posterior aspects of the trochanter. So when we take a point like gallbladder 30, which is from the sacral hiatus to the highest point of the trochanter, and we come in about a third, we're actually below piriformis in this position, and here we're going down towards the deep rotators. So we're thinking about those structures there that we might be hitting through glute max. So that's your anatomy of the hip and how to find those. So we've got TFL, glute max, glute med, glute min, deep to that, piriformis, and then the deep rotators there as well. Okay.